Hey, all you beautiful ethic cuties and the 40% of you who have still not subscribed to the Ethicsverse, welcome to the coolest place to be. Every Tuesday at noon Eastern, if you think fixing our healthcare workplaces can fix our world. I got a real treat for you today. We're talking about mastering regulatory change. This is a part two. I'm calling this the healthcare party bus, okay? We got a great group together for you guys today. As we get started, like I say every week, your network is your network. Give me a follow, give the panelists a follow on LinkedIn, and drop your LinkedIn URL in the chat. You got to take advantage of this market that we're a part of, this amazing community where you don't have to reinvent the wheel. We had Mel Sponholz on, I think about a week ago, and we were talking about mentorship. And we live in an entire market, an entire community that's built on this mentorship. So reach out to someone, expand your network a little bit. And if you are part of this 40% that I'm calling out every week, you got to subscribe to the Ethicsverse. You get free CEUs every single week. So if you're looking for CCB credits, you're looking for SHRM credits, you're looking for HRCI credits, you're thinking about pursuing a compliance certification, this is the place to be. We get messages every month of somebody who passed their test and they attribute it not to me, but to this community and what's going on in the chat. So a lot of great podcasts coming out. If you have not done so right now, take out your phone, click your podcast button, search for the Ethicsverse, follow that. Also give us 5 stars, like a preemptive 5 stars would be phenomenal. We just had Mark Jaffe on. This was a great episode. So constantly we're trying to push out thought leadership. We want to give a platform to people that have a great perspective so that we can do our jobs in a more effective way. And we can pivot and hit this kind of pivot point that we're approaching where the next 10 years can look wildly different than the last 10 years, but it's going to take us showing up differently. It's going to take us employing new frameworks and new mentalities to bend the curve on our programs and the impact. Speaking of bending the curve, everybody's talking about AI, of course. My good friend Reed Blackman, you should absolutely follow his Substack and follow his podcast as well called Ethical Machines. We're giving out this book. We need to wrap our head around AI. We're going to be touching on that briefly today, of course, and then whatever's coming in the chat, we will be weaving in like we always do, especially for those who are going to be winning one of these 5 books. So I'd encourage you to pick this book up, even if you don't win. It's a great book, and start following Reed on his Substack and follow him elsewhere. I want to share this little video with you because, you know, we're always striving toward more effectiveness in our program. That comes from us making good bets with our time and making good bets with the resources that we have been allocated. And also, we need to develop the peace of mind to know that the way that we're spending those resources or directing those resources is going to move the needle in the most effective way. Getting a handle on disclosures, getting feedback loops and points of risk intelligence from the broad organization can do a lot, especially when you can do that efficiently. So I want to share this new tool that we have developed and we are pushing. So you
the
can
auditors just called.
They
want to see last year's disclosure records, but they're scattered across emails, spreadsheets, and shared drives. Half the forms are missing and the rest are inconsistent.
Transform your disclosure management with Ethico. Templated forms for COIs, gifts, and incidents with branching logic and easy configurability. Every disclosure tracked, time-stamped, and securely stored. Easily drill down and filter by status, location, disclosure type, and more. Automated sends and reminders ensure nothing falls through the cracks. Real-time comparative dashboards reveal patterns and emerging risks. Ethico disclosure forms. Manage, mitigate, resolve. Talk to your client success manager to learn more.
Yeah, talk to your client success manager or hit the demo button on here for a no pitch zone demo. It's on you. It's incumbent on you to know what's out there. And this is your last chance. This is the last week to take advantage of this Promised Land promotion, which has been wildly successful for us. So you get up to 15% off, up to a year free, based on you coming over from one of these other providers. So whether that's OneTrust, whether that's Conversant, whether that's Navex, we got the Promised Land for you. All you got to do is cross the River Jordan, but time is running out on that. I had dinner last night with my cousin who was employee 83 at G2, and I showed her the, G2 is like Yelp for software companies. It's actually more like Angie's List, but nobody knows what Angie's List is anymore. I was showing her the awards we won, and she was like, this is actually phenomenal. This is a testament to, the way that you guys are interacting with people. And this is always a great early sign for a company that's growing a lot. So we try to put our money where our mouth is and make it easy to make the change to help you through that change management. But round of applause to the Ethico team. Momentum leader. Look at these badges. These are all over the place. I'm passing them out to my kids as well. Ethicsverse Day is about a month away. We have 4 powerful sessions, up to 12 CEUs if you attend. We have FBI informant. We're going to be talking about whistleblowers and informants. We're going to be talking to former DOJ folks. We're going to be talking to prosecutors. We're going to be learning about AI. This is all about a full day of a ton of learning, a great community, and we're going to have a lot of fun, bunch of giveaways. So circle your calendar. If you got some PTO stacked up, July 24th is going to be a great day to spend that if you need to. Okay, we have a really great panel coming up here today. We have the one and only Donna Schneider. Let's get a massive emoji explosion. Let's get a massive Ethicsverse welcome to this august panel. We have Donna Schneider, we have Laura McNamara, and we have Alex Wright. Valerie was going to join us, but something came up. Before we dive in, though, our slide is not uploading for this really cool conference that's coming up. Laura, do you want to tell us a little bit about it, and then we'll share the details once it gets uploaded?
Thank you, Nick. Hi, everyone. So I want to take a moment to plug our conference at the end of this year. It's held every year, as a matter of fact. We are celebrating our 31st year in existence in 2025. It's NAHIA. It's the New England Healthcare Internal Auditors Conference. It's a joint conference with HFMA, and it's 2.5 days of internal audit, compliance, privacy, professional development, networking. And it's great food, great location in Mystic, Connecticut. I am so proud to be on the board along with Donna and Alex. We really put together a great lineup of speakers and exhibits and great opportunities, again, to network, collect your CEUs and what you need, and we'd love to see you there. It's a great way to jam in all of those credits that you need for a very affordable price. So check out our website, nahiaconference.org, and see you December 3rd through the 5th in Mystic, Connecticut.
Joe had just dropped a link in the chat. We will have a graphic up here shortly. But today's episode, so thanks for that, Laura. Today's episode is a follow-up to a previous episode we had. There were so many questions in the chat that we wanted to do a follow-up session to address those things and dive a little bit deeper. So that's really what we try to do here on the Ethicsverse. We want to, like I said, add value. We take very serious the time that you spend with us each week, sometimes twice a week. And we want to make sure that...
The auditors just called. They want to see last year's disclosure record.
I want to make sure that you see a commercial a couple of times, okay? Just kidding. Okay, so we're going to dive in, and the first comment we had from last time was around AI. Like, how do you validate AI-generated regulatory insights if you're using them? How are you directing people on your team to use AI to leverage some regulatory oversight? One of the things that I've seen is first kind of checking those sources. So I'd love for you guys to weigh in, but the guidance that I give is to, try to use the deep research function on whichever tool you're using. The deep research function should give you a list of citations. So on Gemini, if you do deep research, it'll give you you prompt it, it's going to show you its thinking, and it's going to show you sources for any of the things that come out of it. And so what I've done is I've tested a couple of times. I've gone and done the research on a particular regulation, like a breach, risk assessment. What should be contained in there for a low co-pro, designation or conclusion, and kind of tested that on my own, and then seen what it generates. And you can compare those results, and you can kind of start to get a feeling before sort of like blindly trusting, whatever comes out of that. Anything to add from that, Alex or Donna?
Well, I would say. Oh, go ahead.
Go ahead, Donna.
Alex. You go.
Thank you. I was going to add, at Stony Brook, they are starting to implement a lot of AI surrounding medical record documentation for our providers. And I think one thing really great that they did was that they first contacted compliance, but that gave us an opportunity to kind of do a little bit of a demo with them, to have a provider, a conversation with a sample patient, to have that documentation generate. And then from a compliance standpoint, being able to go in, review the documentation, and capture any inconsistencies or typical things that we would find on an audit. That way they're able to implement that and know what to look out for, particularly if they went with the software at hand. But I think that's a great first step, although I will add that we are still in the very early stages of it. So I don't have too much to comment, but I think definitely tapping into the resources available throughout the organization, those subject matter experts, to be able to help and kind of formulate which would be the best fit for the organization.
That's great, Alex. What would you add to that, Donna?
Well, I think my experience has been a little bit different in that nobody called compliance. Imagine that. So it was incumbent on me to reach out to different parts of our organization. And we've been a little late to the party in terms of getting a governance together. So making sure that compliance is included, and where we found out that there were different AI tools being used, including those in our audit plan, and really making a presence for ourselves and for the organizations, because sometimes people may forget to call you. Again, imagine that. So being part of that, we now have, like I said, we're going to have some structure, we're going to have some cadence. And I think being alert to it, it's hard to control all that. You can't control all that. The best, in my opinion, you could do is be a party to it and work to be a resource for it. We've had AI in some of our functions, some of our audit tools for years, but now it's just who's using it? Is there PHI in it? Where is it going? How are we regulating it? So we're in a whole new world. And I think that in compliance, instead of saying, oh my God, what are we going to do about this? Being a partner and being a resource with it, whoever uses that in your organization or influences that in your organization are the people you need to speak with.
I think that's spot on, because like we don't know what we don't know. And when we do know something, or we do have eyes on something, we can sometimes help get something unstuck. With respect to that, Laura, what would you say if someone feels like they're a little bit behind, or they feel like there's probably a lot of AI usage in the organization that they haven't put eyes on yet? Like, how would you kind of strategize with them on how they can do that and how they can, get eyes on those things?
So curious that you chose me to lead in with this. Because I'm new at my organization at UVM-HN up in Burlington, So coming here and going, what's going on with AI? What's the happenings? And what I have been able to find out very quickly is that we have a strong and very dedicated AI governance committee with a full-blown charter and a great group of committee members. But even looking at that and having some discussions as of late, as a matter of fact, just yesterday, I emailed one of the committee chairs and said, will you consider adding an additional person from our department to add in and bring in some value as well? So really like just getting in the know of what is going on and finding out if there is a policy in draft, in development, or already published, as some people may be sophisticated enough to have. But then also, what are you doing about it? And what is the definition of AI? How are you interpreting AI as true artificial intelligence that's maybe in the EHR developing materials after visit summaries? Are you thinking about it in a way of like coding, where they're assisting with coding and encoders and assigning CPT and diagnosis codes? So the more you know, but being curious, asking good questions, and getting a feel of the landscape is really the first steps to success.
I think that's right, and I'm glad that you're sharing this experience, because I think that curiosity is the key, and I think just having that curiosity is such an antidote for any defensiveness that might be sort of latent from maybe the person, to the program that you're inheriting, or just the stereotypes that people might have. I think when that guard can be down, then you can start to see again how you might be able to like fit into that. I'd love to open this up to the panel. If Laura stepped into an organization that has an AI committee, or there's some governance sort of in place around that, and that thing is beginning to like move forward. If somebody in the audience is in an organization where they're not that fully baked, what advice would you give them? Let's go to Alex and then Donna on forming something, or where should they sort of get started? A, and B, Laura, maybe you can weigh in on this. What would you expect from what would you expect for this, governance foundation, whatever you want to call it? What would you expect from them in terms of collaboration across, different business units?
I'm going to go ahead and start with that since I have the ball rolling. Really thinking about AI's impact in four specific corners. I would think patient safety first and foremost, quality of care. How can AI be used to help the momentum there? Patient access is another area that you could really delve into and question the use and leverage of AI, and as well as affordability. When it comes down to it, what can you even afford? We see a lot of AI. I was thinking about this after our last huddle. Yeah, AI is all around us. And we do see a lot of it in our current training and education and outreach programs across our industry. But as it starts to step out of the office and into the clinics, what are we doing and who are we connecting with? So making sure that all of the appropriate clinical stakeholders is key.
That's great. What would you add, Donna, and then we'll go to Alex, either in terms of like where to look, or really kind of where to get started if nothing is in place yet?
Because that's my experience, so I can tell you what I've done. I spoke with our Senior Vice President, Chief Information Officer, our Vice President, Medical Information Officer, and our Chief Information Security Officer. So a lot of acronyms, but really the key leaders in IT that are worried about medical informatics, the system as a whole, and then information security. And really, what's our overriding plan? What is our plan to get governance moving? Who are we going to involve in this? Because we're an academic medical center, so we have a whole research component. And so that's a whole nother entity that we want to make sure we stay engaged. So working on that, we ended up hiring a director of AI who has started to put the governance together. But I think, as I said before, making sure that you're having those conversations and that you're interested, and then bringing other colleagues, whether it's the folks that Laura mentioned, patient safety, quality, risk management, bringing them all along, and then advertising or educating the workforce. People want to know what to do. And by and large, people want to do the right thing. So whatever processes you put in place, you need to make sure you educate all different facets of your workforce. We have 20,000 people that work here. How are we going to touch base with them all and make sure they know what to do or what not to do, or when to call or when not to call? So I think really being proactive and reaching out to those key leaders was the start I had here.
That's good. What would you add, Alex?
Along the same lines as what Donna had said, I would definitely start with informatics, anybody who has an interest in informatics within the organization. But I think most of us in today's day and age come from a very highly matrixed organization, where I think relationship mapping and kind of pinpointing, creating a visual of all of the different touch points throughout the organization can really help you get to the right person in order to be able to provide them support. So who's who, what are they doing, what are they involved in, and then being able to identify the types of influence that each of those individuals have. And that way you can kind of get involved looking at what interests they have, how you can support them, and how you can create that buy-in and be part of the table when decisions are made, especially when it comes to AI as well.
Yeah, I mean, there's such a through line between this topic and so many other topics, where this is really just another risk. It's another thing that we need to learn about. The same thing would apply to a new regulation that's coming out, or a new technology that sort of changes the privacy landscape. We have a whole tool set that we've developed throughout our careers of being able to look at a particular risk, understand what that risk or how that risk might intersect with the context of our business and the constraints and so forth that we have in place, and like acting upon it. And I think when we can look at it that way and not get sort of overwhelmed by it and start thinking like, oh my gosh, this is so terrifying, I think we can add a lot more value. And again, the compliance officer of the future is somebody I think that is going to be a business person first, and is going to be focusing on how can I de-risk this organization to improve the level of quality in the organization. And I think when we show up with that kind of a mandate, it's a lot easier to start kind of put those gifts to work in the context of this new technology. All right, I want to pivot over into policy management. There was a great question from Nicole in our last session, and she said, how often is policy management a part of compliance versus other areas like legal or HR? I think why this is interesting is because we didn't really get a chance to dive into the strategic implications of where policy management sits operationally inside of an organization, and how that placement might ultimately affect compliance effectiveness. So with respect to Nicole's question of, where is it most strategic, I guess, for policy management to sit? And if it sits somewhere else, how can we improve the effectiveness of our program? I'd like to start with Laura on that, and then go to Donna and Alex.
Thanks, Nick. Well, I don't think that any one house or unit should own policies. I think to know a policy or procedure is to be embedded in it. However, I do think that it is best practice for the compliance department to own the policy on policies, if there is one, right? To set the tone for which all other policies are set forth and follow. And then having an actual policy and perhaps procedure committee as well from all the different stakeholders, developers, publishers, and editors. And then, of course, going back to why do we even have policies in the first place? How do we handle conflicts when there are multiple departments that want to own a policy? EMTALA is one I was thinking about recently. Who should own the EMTALA policy? And what's the why behind that? I think it's a group effort. The fact that people want to own policies, I think is a good thing. We want people to own, and I'd rather have that challenge of finding out who's going to own it rather than people not wanting to own it, not wanting to embrace it. But you really have to lean in and commit to policies if they are going to be in your house.
How about you, Donna? What would you add to that?
So I can give you my experience. I've worked in 2 organizations where compliance owned policy management. My current organization, it was owned by Quality for a long time, and with no real direction or outpush, not to anyone's fault. It just wasn't kind of managed that way. So once we, in compliance, took it over, we've been able to put some structure around it. We don't own all the policies. We certainly have our subset, which we own, but what we do is manage the process, meaning that we're managing those policies that run out of cadence. They need to be renewed. They haven't been renewed. So following up with those stakeholders, having a policy oversight committee that reports to the system compliance committee. So there's accountability. There's a dashboard, making sure the approval workflows are working, because long gone are the times where you could update your policy on paper and just post it on the intranet and hope that somebody reads it. I think we need cadence about what's a policy, what's a process, what's a procedure, and what's a guideline, because policies are what the regulators come to look at when you get audited. And if you have a policy that's out of date, that's not good. If you have a policy that people aren't following, that's not good. So we've started to put tags on all of our documents and really narrow the scope of what is a policy to something that's legally or regulatorily required. If not, then it's a guideline or it's as a procedure or what have you that I just spoke to. And so the frontline staff knows what that tag is. And then we monitor it to make sure all those documents, and there could be 4,000 documents in your database, but they're all tagged appropriately. They're all within reason, we have a 3-year cycle, are all current, and then the approval workflows are current. And there's not something sitting out there that XYZ leader has not approved. And we've actually reinvigorated our process such that any new policy has to come to compliance first. Not because we're territorial, but we want to make sure we are looking to make that there's not a duplicate. Because we're going to systematize. We have 6 hospitals, 3 physician groups, and a consortium of group homes. We want to make sure that as much as possible, we have a systemized policy, and those that need offshoots to it can have addendums. But as much as possible, people know the generic policy and can move from there. So in my opinion, because compliance is in the center of a law, we're collaborators, we're here to make sure that people all work together. And at the end of the day, somebody has to be kind of the heavy. So if somebody's not doing what they need to do, they get a phone call from Donna Schneider, whether that's good or bad.
Yikes.
Yowza.
Also, but it can be nice, though. It can be nice, let's be honest.
Somebody called me and said, hey, what are you doing today? Want to go for a cup of coffee? Never happens. But just that way, there's structure to it. And we report to the System Compliance Committee. We report to the Audit and Risk Committee of the board. So I think that's given it some sort of cadence. Could HR do that? They could. Do they want to? I don't know. Could legal do it? They could. Do they want to? I don't know. But for now, I think it's worked fairly well. It's a marathon, not a sprint, but we're on our journey.
I have a follow-up question to
please.
Donna, if that's okay. And this question may be in the chat, so apologies for redundancy. But
you can steal whatever from the chat, by the way. If there's something smart in the chat, you can just say it. You can take credit.
Okay, great. Good. So Donna, how do you resource that? Are you automated, or do you have like a dedicated workforce member or members who are doing that work? When you're talking, I hear about all the time in FTE and the manual labor that is involved in that, and then the chasing down and enforcement. So how do you operationalize that?
from the top. So how this all started, I was in a meeting not paying attention to our executive vice president, CFO, and that's how I ended up with policies. So, okay, that's great. And when policies came over, they came over with an FTE. Okay, that's great. And that's the only FTE we've ever had. And so it's a communication from the top, setting out the expectations, having that executive reinforce them, and then, whether by reputation or by the word compliance, I'm not sure, we've been able to chip away at it and really get to where we need to, putting parameters around it, making that policy on policies readable and understandable. We did a policy stat town hall. It's called policy stat, not to advertise another vendor, but that's what it is. So we did a policies town hall, engaged our senior vice president of nursing is very much engaged, and that's a core component. So we have her as our champion and just really making those relationships. That's how it's worked. I mean, are we perfect? No, but we're measuring, we've set out metrics and we're measuring ourselves against those metrics for this fiscal year. And I'm happy to say, we're going to hit them so far, knock on wood. So that's really how we've done it, and just kind of chipping away at it and being, and I've been involved. So I haven't just left it to the manager of compliance or the compliance analyst who did it, but we have not gained any other FTEs, though I've tried, but have not.
This webinar, this is not like a baby food webinar. This is not like a play school webinar. There's you guys are dropping such phenomenal insights, and we're really diving deep. And I'm just trying to wrap my head around how there's only 800 emojis, but that doesn't matter. But I want to address this question that I think Grace brought up, or it's more of a comment really, that some organizations think policies, processes, guidelines, et cetera, are all the same thing. I'd like to kind of double click on, what you kind of described, Donna, between a policy maybe being tied to an actual regulation or an actual law, like something that's a true kind of obligation, and how you explain the difference between policy, procedure, process, document, or guideline. Is there kind of a stark line between kind of what is policy and then everything else? And how does that hierarchy work? How do you communicate that and, juggle all those documents?
Right. So what happens is people love to say, well, we'll just do a policy on that. You can't put any, flyers on the wall. We'll have a policy. Well, what is going to happen with that? Do you think that's going to make people less apt to stick a flyer on the wall? I don't think so. So it's about education. And it's really that message that I just said to you is policies we can't deviate from. So that's why we made the decision in the Policy Oversight Committee of those different parameters. This is what a policy is and that definition. This is what a guideline is, because clinical folks really, clinical pathways, different nursing guidelines, they need references, best practices to attach to. And so we started working with them to make sure we had that. And this tagging process, that's what really happened. So, working with radiology, you have, I don't know, whatever it was, 50 policies. They're not all policies, point to the regulation. So it's multiple meetings, but really getting people engaged to have them help us make those definitions, and then continuously looking at the new policies. I mean, the manager of compliance every week is looking to see what our system can't stop a policy if we haven't seen it. So it's sort of backtracking and then having those conversations. So we made it very clear in our policy on policies, and then it's having those conversations afterwards. And policies are very emotional, people. I didn't know that, just FYI to anybody. People are tied to their policies.
Yeah, they're like recipes. You should see my grandma's cookbook. She won't let anybody get their hands on it. That's your thing, Oh,
no. But it's, again, that education. I think we have a compliance tips for you email that goes out once a month, and we've embedded things in there. As I told you, we had the town hall. We also speak at each hospital management committee meeting. So really getting at all those different venues. I'm now working on trying to have the CEO actually put a little time to this in some of his communications and podcasts, videos. So it's trying to touch people in all different ways with those standard definitions.
I think, I've said something like this before, but, according to Gordon Ramsay, there's only one way to make a beef Wellington, right? There's not a lot of variation in that. And I think a lot of times we think compliance is like that, where there's this strict kind of way to do it. And I love cinema and I love movie directors. And I was watching an interview with a director recently, or it was a whole table of these directors. And I was seeing they're all different. They all have different personalities. They're all trying to make a different movie. They all have a different set of constraints, and they're telling stories about this movie or that movie. And I think running a compliance department is much more much closer to like being a movie director, where every movie's different and every business is different and every situation is different than it is to, following this strict recipe. And I think what struck me in what you were saying, Donna, is like, you're just trying to solve the problem. And like you said, hey, you have the humility to say like, look, we're not perfect, but this is how we're trying to solve it. And this is where, I'm trying to get in where I fit in, and I'm trying to, add value to this broader process, to the extent that I can. And I think that iterative mindset, that sort of creator's mentality, can allow us to kind of evaporate away some of the anxiety of like, quote unquote, not doing it right, and shift it to saying like, well, what am I trying to actually solve for? So Alex, let's go to you, because I think you have something to say on your kind of policy philosophy, whether where it should live or just kind of how to better administrate it, or how to add some value to this piece of the puzzle that's extremely critical, but kind of a little bit different in every organization.
Absolutely. And, one thing I do agree with both what Laura and Donna said about a centralized group that's responsible for the policies. We have at Stony Brook Medicine, again, highly matrixed organization, that we have the hospital side and then the clinical practice management side. And the hospital side utilizes a policy manager system where all of them are easily identifiable. You can search for them and whatnot. But you got to maintain the update date and make sure that everything is up to date, so that when people do reference the policy, they're getting the most accurate information. On the clinical practice management side, I think one thing that we could improve is the accessibility of these policies, because we have them, but we need to make sure that our workforce members know where to go, where to find them, and then to be able to utilize them in the real world situation. In terms of creating policy specifically, I know we just actually had 8 new policies that were deployed earlier this year. But just being able to take some of the feedback that we've done a little bit of research on policy management and creating policies, but just again, making sure that they're applicable to the audience, and also checking with other departments that you're working with as well, because they may have some overlap there. I mean, while you may be the central owner of the policy, it may have implications for other areas within the organization. And again, just making sure that the language used within the policy is easily digestible and understandable, so people know what to do with the information once they read the policy. Those would be my 2 key takeaways: making it easily accessible and understandable.
And then, you mentioned something just like a second ago about, conflicts. And Donna kind of alluded to this as well across this, this massive business with different businesses sort of underneath the same umbrella. How do you handle policy conflicts when multiple departments claim ownership, or multiple kind of departments do things in a slightly different way? Do you rectify that in the policy itself? Is that more of a sort of like local procedure thing? How do you juggle those kinds of conflicts and diagnose those? Let's start with you, Alex. We'll go in the reverse order.
Thanks. I thought the question was for me.
It is.
I think there's 2 different routes you could go. So I think that there are some policies that have overlap with some of the data perhaps is owned by another area within the organization, that you're utilizing that data for your policy. And I think checking in with them, just making sure that there's no overlap, that you're not stepping on anybody's feet if they already have an established policy. I think that would be first and foremost for those types of situations. There are shared policies, of course, absolutely, when you think about compliance's relationship with human resources, and even tracking the exclusion screening process. While HR may be responsible for any disciplinary actions associated with that, compliance is responsible for running the exclusion checks and making sure that the information is up to date. So I think in those types of situations, it's definitely important to clearly define each of the department's roles within that specific policy, so that there's accountability for that. And that way it outlines the processes and making sure that each of the functions are performed accurately and timely.
Yeah, if you're not articulating it, it's hard to kind of define what a clean handoff is. And like when there's not a clean handoff, there's always a jump ball, or there's always some volatility in the system that is risk, like by its nature is risk. What would you add to that, Donna? And then let's go to you, Laura.
I would say, and sort of alludes to Laura's question before, everyone has their role. So I'll give you a real life example. We discovered that there were 7 different policies on what codes were, like code gray, code blue, code red, code orange, etc. And so the manager of compliance convened a work group with key stakeholders from both the centralized, our transfer center, and then the different hospitals, and we have 2 states of operations. So everybody who needs to be at the table is at the table. I kicked it off, really saying we need to come to one centralized policy. That can have offshoots if it's required, something's different for Massachusetts versus Rhode Island. but I need this central group to work through this. And it's going to be, again, a marathon, not a sprint, but we need to give, even within the state, we had different guidelines. We need to move this forward. Did anybody ask us to do this? No, but we discovered we had these different policies. So outlining the parameters, somebody kind of given the, being the heavy, that's me, that's kind of my job. And then the manager of compliance is a very detailed person. So she set out the project plan, set out a monthly cadence of meetings, set out the goals. So everybody understands what's asked of them, what the end goal is, and what are the milestones in between. I'm sure we'll have bumps, but that's how different people feeling ownership, and these were owned by all different people as well. So that's a real life example that we just encountered just yesterday. We had our kickoff meeting. So just to give that perspective, it takes time, it takes buy-in, but that's also, I think, the reason why the compliance leader, at least in my case, I'm meeting with the senior leaders of all these different hospitals twice a year, whether they want to see me or not. I mean, we meet up in other meetings, but just hey, I'm on your calendar, I'm coming over for 15 minutes, and just talking. So you have those relationships that you can rely on when you get in situations like you need everybody to row in the same direction.
Yeah, I mean, establishing those relationships are super critical, but it takes that kind of forward pressure. Like, you're
Right.
like getting the people in the room and you're like, okay, we have to get this done. And,
Right.
again, I'm just so struck by this like director thing. A movie doesn't make itself. A program doesn't make itself. It takes someone to push that forward and coordinate all these different people to kind of tell this story or, put this, this picture on the screen. I got to make a video about that or something, because I just feel like it is so applicable.
And it's
I want
also
to talk
who's doing it and by when. I mean, that's the thing too, Nick. So, the director has different timing. So whatever whatever your kind of shtick may be, it's who's doing it, by when, and how, and just staying up on that.
It's a lot of coordination, and it's a lot of that kind of high agency forward pressure that, you have you can very rarely be a tyrant and make a great movie. Not anymore, not in today's America or whatever. But so we have to kind of be that, have that intentionality carved into our calendar where, I mean, you're not saying, hey, twice a year I'm going on a weekend trip with all these people. You're talking about a 15-minute meeting just to touch base. But it takes that intentionality, because those meetings don't just show up. Okay, I want to talk about drafting policies. There was a good question, and there was a lot of chatter in the chat in our last episode on this stuff. And it kind of revealed a gap in any formal training around a fundamental compliance skill, which is drafting policies. So if somebody is new to compliance or they don't feel like they're great at it, what advice would you have? Let's start with you, Laura, then we'll go to Alex and Donna. What advice would you have for someone to get better at writing policies? And, maybe philosophically, what makes a policy good versus just legally sufficient?
Great question. Happy to be here and answer another policy question. I have been working on policies for dozens of years, and I tend to benchmark as much as possible. And, benchmark, poach, tomato, really taking from other industry folks to identify and glean what is the purpose, like why do we have this, and really trying to get benchmarking information to determine how are we best going to write this policy, implement the policy, and then measure its effectiveness. I think that's the reality as we move toward, a more efficient and effective compliance program and meeting the expectations of our regulators. But efficiency is a practice, right? And as I try to get comfortable in the world of policy development and writing, which is not my wheelhouse, I really try to remember who's the end user and why are we even doing this? Why are we even writing this policy in the first place? And really keeping that in mind as we go forward. So I like to look towards my friends. I like to call Donna or talk to Alex and go, how are you addressing this type of policy? Does this policy live in your world? Donna is a hard yes, of course. But if not, like, who are your stakeholders and how do we develop it? There are lots of templates out there. The HCCA has a great workbook with some templates as well. You could even use AI for the most part with a lot of policy development these days. But ultimately, how is it going to stand up? How is it going to look to the regulators? When we were going through an Office of Medicaid Inspector General self-assessment from the state of New York not too long ago, they really wanted to look and scrutinize our policies and make sure that they weren't just paper, that they had legs to them and they had efficiency. So really, when you're going to put in the work, make sure that it's aligned with others as well, that there's strength in numbers.
More gems. I told you it was a real treat about 45 minutes ago, and boy, was I not lying. Okay, Alex, what would you say to that?
I think just along the same lines as Laura. I mean, a good policy versus a legally sufficient. Legally sufficient meets the regulatory requirement, but I think when we think about a good policy, one that's understandable and digestible, it really goes into the why, the definitions, the actionable items that people can read through and know step by step what they have to follow. But I also agree with Laura in terms of where do you start in developing policies, especially if you're new to it. And I also like to glean, what are other organizations doing? Tap into your resources, your network, see if they have policies that you can reference just to get an idea of the format. Look to see if the organization has templates that you can kind of plug and play. And talk to the subject matters experts within your organization. So whether you're checking in with legal or risk management, you're working with HR or operations, but tap into their knowledge to be able to create the best policy possible for your organization.
I think that's great advice. And I think what I would add is also trust your own gut. Like, put your own English on the ball. Like, you have context that a lot of people don't have, it just based on the role that we're in, right? Like this, I think Donna said earlier, compliance touches so much. So we have a lot of extra data points that other people don't have. And I think it's incumbent on us to make sure that, whatever risk mitigating efforts we're putting into place have sort of passed through the filter of self. Donna, what would you add?
The other things I would add is make sure that people actually are doing what they say they're going to do in this policy, because the worst policy to have is a policy that's not followed. That's when you get in trouble. And then the second thing I would do is engage marketing. I'm a very strong proponent of compliance collaborating with marketing, because marketing, internal marketing and external marketing, but in our case, we have different divisions. And so they are focused on communicating with our workforce and how to communicate policy. We want to make sure we have a policy that everybody can understand, no matter what role they have. So we work very closely with marketing on policies. This is not from a, kind of technical standpoint, but from a readability standpoint. Less is more. Get out words that you don't need to have in there. So that would be the other advice I would give, is find a collaborator in marketing that you could work with. And that would be true for the code of conduct. That would be true for the notice of privacy practices, or for anything else that you might want to reach out, other educational tools. Marketing is a great ally to have when you really want to reach the workforce and make sure it's understandable and it could be absorbed and implemented.
In that return on integrity workshop we did a couple of weeks ago, we were talking about this concept of persuasion. And what you described at some level is kind of some persuasion. When you're going to somebody with a draft that's going to affect them and you're getting their input on it, not only do you open up the possibility that you're going to get some insights that maybe you didn't see because you were too close to it or you lacked context about that particular department, but you're also bringing that person into the process and they're sort of blessing it before it's ready. And that is a much different outcome in many cases than if you're just saying, hey, here's the new policy or here's the new thing that's in place. You kind of, you can kind of grease the skids a little bit when you do that. And I think you also benefit yourself in a couple of different ways.
The other thing I'd say too, Nick, in this environment, it's so easy to just email things around.
Totally.
So, and that gets
totally right.
Way too easy. So forcing, or that's a bad word, but setting up the meeting, having the meeting.
You're the heavy though, Donna. That's the word. Okay.
I mean, but that really gets people where they need to be, because I can't tell you how many times I get an email and it's just this whole big data dump and I'm thinking, I have no idea what you're saying. Let's have a meeting. And maybe that's just how my brain works.
No, I pull those into spam actually. Yeah.
It goes to spam. But that's really, to me, how some of this collaboration can work, because then you could see each other if you're not local to each other, or just, and making that intentionality to talk to that person really goes a long way, particularly where policies are so emotional.
So Alex kind of touched on this, and I want to spend a couple of minutes talking about this because, as Donna said, the worst policy is one that people don't follow. But in my experience, I've found that if people don't understand the why behind the how, or the why, or the why behind the what, whatever, the odds of them following something or following through on something is way lower. So there was a comment from Sandra last time that was really, talking about how important it is that people find the why, and then explaining the how in the context of that why, particularly around updates to policies or changes to different programs. And so I'd like to talk a little bit about, I'd like to kind of go around the horn here and get some kind of some concrete examples on how you've been able to do that, or effective ways that you've been able to kind of establish that why. Let's go to Laura, then Alex, and then Donna. A couple of good ways to establish that why with these different stakeholder groups, because what might resonate with one isn't going to necessarily resonate with everybody.
Yeah, I like to use the term relationship mapping. That's something that for me, I have found that if I can connect the dots within an organization and within the appropriate stakeholders, it helps click, and it helps with that cultural buy-in. You need the buy-in before you can have any type of success. I also think that helps set the risk dial as well. That's something that I'm doing in my new role, is really just seeing where that dial lives and where there are any gaps or improvement opportunities, and where they live. So thinking about rolling out any type of new policy, how that's going to affect the departments, or not even just the policy. As we move towards our public relations roadshow that we're doing over the summer to introduce me to the organization, and we're actually going to be launching our first compliance and ethics week this fall. We're really trying to gain and glean from others. Where are the relationships? So we can tie that all in and have a theme for our compliance and ethics week. See the information that you gave us, and the clicks and the ticks and the ties with all of that buy-in and all that work that we're doing now is leading up into this launch of a compliance and ethics week, and then all of the work that we do in the next year after that. So what does that look like? It looks like finding the influencers, right? It's not just about the title, it's what people are doing, where their influence is, and where the hierarchy is in the organization.
The true power hierarchy, which is the true influence hierarchy, which might not be the title hierarchy, to your point.
Correct. So by observing interactions, how people work with each other, especially in meetings, I'm always just watching everybody else. I'm also looking to see if I'm due for a haircut, as I mentioned to someone yesterday. But also, where are those informal conversations? So I like to be out in the clinics and other locations, just as drive-by highs, and just making sure never to make any assumptions, of course, and really just getting to know the people and figuring out how everybody works and clicks.
That's great. Alex, what would you say on that?
I think that's definitely, Laura, to your point, that's definitely a very important first step, because then you're able to kind of separate the group. So you have the leadership, you have the frontline workers, and then you're able to foster and build that trusting relationship with them. But I think also, as you do that, first and foremost, you really need to create that shared vision. And one thing that's particularly helpful with that is using we. How can we do this? What are we going to do, so that everyone sees each other as a team? Because ultimately, that's what we all are. We're a team. We may work in different departments and have different roles, but we're all working together towards that shared vision. And I think in terms of building trust with the two different groups, with leadership, you really want to tie it back to that strategic framing. So the risks, the performance, the return on investment, and then also the efficiency. So being prepared to present your messaging and your feedback as well. And then alignment to the organizational goals and metrics. And in terms of the frontline workers, it's a little bit different. You really want to have that empathy and presence, showing the understanding you get their workload, their day-to-day, and also genuinely interested in the feedback that they have as the people who are actually doing the work. What feedback do they have that you can take back and improve any processes or policies going forward? And then also the messaging that you're taking this feedback in order to help them to make their work easier. And really building that trust will help you, with both groups, will help you get very far in whatever type of project you're working on, whether it's policies or so on and so forth.
So there's so much phenomenal advice packed into that clip. I was actually specifically asking if you thought Laura needed a haircut. Just kidding. But you were talking about actually connecting.
I was hoping we could get some thumbs up emojis going if I need a haircut.
I'm kidding. I think your hair looks phenomenal. But you were talking about connecting as you go kind of up the chain, kind of connecting to the strategic objectives of the organization. And I think in healthcare we have an overarching thing that we can always connect to. And I think when we can recognize that different stakeholder groups get something different out of their job, in the pursuit of patient care and better healthcare system. Within our organization, the odds of us, resonating with them can be a little bit higher when we can kind of tune into some of those things. What would you say, Donna, in terms of really driving that why?
I think it's starting off the conversation that compliance is here to be supportive, not here to whack anybody on the head like a whack-a-mole. We're here to support, we're here to guide, we're here to be a resource. And the why varies on whatever the topic you're talking about. At the end of the day, we're here to serve our patients. So just what you all have said, but really making that connection that people feel comfortable when you're engaging with them. And so we have a tagline that we use. We're talking about communicating, educating, collaborating. So keep that momentum up with all the different stakeholders they're meeting with, and then being responsive. Even if you don't know the answer to what they're asking you, I'll get back to you. I don't know the answer right now. Let me ask a few people. I'll get back to you. And then doing what you say you're going to do when you said you were going to do it. I think all that matters into what the shared why is for anybody that reaches out to our offices.
And I think kind of a lot of what you're describing there is kind of this others focus. Like, how can we be of service to you throughout the organization to help, the organization run more smoothly? That's really what our job is at the end of the day. And so I want to pivot now to talking a little bit about emotional intelligence and leadership, and how empathy plays an important role in us getting things unstuck. Like we've talked, multiple times today about the importance of building those relationships and having those actual connections to get the buy-in that's necessary. So can you either share, I'd like to go to Donna, then Laura, then Alex. See, I keep kind of changing it up. This is like a shell game here. Donna, Laura, then Alex. Can you share a moment where your EQ really helped you navigate a tough challenge or to get some buy-in? And what actually made that difference? What role did empathy play in this whole thing? And, how were you able to get something unstuck?
So I can give you an example that happened this morning. I was in a meeting about a new regulation that's coming out related to privacy in February of 2026, and speaking with someone, and we had a disagreement about how we feel the organization should handle it. And this person just started yelling. We're in a team meeting. Yeah, and so something obviously was going on, because that's not in their character. So to try and, deal with the situation, I just stopped the conversation. I'm sorry, there must be something going on. Finding out later that there was, and that we'll handle it. We don't have to have the meeting tomorrow, canceled it, and moving on. So I think sometimes it's hard for people to show up as their best self every day, particularly if you're talking about something that you may be differing. There's a strong set of emotions, and we have opposing viewpoints, and it's okay to call it. Kind of call it. It's not something we needed to deal with today. We'll revisit it, whether it's next week or what have you. So I think being in tune to that and not being really kind of shaking it off, that, we're all here to work as a team, and something must have been going on with this person at that time. So I think that's where empathy can really play a role in the seats we sit in, because if something's getting to us, then, it needs to kind of be dealt with. We're not, in my role, I'm not always the first line of defense. Sometimes they're calling my staff first. So that's just a recent example that sticks in my head.
That's a great example. What was that person's name? Just kidding. Laura?
Nice try.
Donna's providing a recent example. I'm going to do a walk back down memory lane to an organization back in my early days when I was on the West Coast. And I was I have more empathy now. I just have grown in my empathy. I have evolved in my EQ. And again, that is a practice for sure. And I was in this role of an audit manager at the time, and we were just auditing and dogging this one specific department. They just couldn't get to the appropriate compliant levels that we expected of the organization. So this several months of back-to-back audits. Finally, that department leader came to me and said, look, we are completely resistant. We've broken down. We thought we were just doing it again, giving the effort and making sure that they felt supported, but we were doing the opposite. They felt demoralized, and that certainly wasn't our intent. So really making sure that we're being empathetic in our enforcement. So instead of pushing anymore, we stopped, we paused, we validated their experience. We had a conversation about the auditing requirements, what would feel more collaborative. They were a specialized department, so looking at their documentation and medical necessity was different than many of the other departments and how they approached their documentation, coding, and billing. So we came up with a more proactive, synthesized, and service line specific process for this department. And I really feel like from listening and adapting to them and their needs instead of forcing them to conform to these audit measures and not compromising, instead just saying, okay, let's start from scratch, let's hit the reset button. We were able to rebuild that trust. We were able to reframe the audits to support and demonstrate our approach as still being compliant and satisfactory to our own auditing policy. We were able to continue to mitigate risk and be proactive and preventive in our approach. And I think we just ended up with a more quality process for this department. And we actually, from there, started to look at all the departments of all the service lines on how we can do better and how can we curate our approach and process that's more provider friendly, really, but still mitigating that risk. So we started doing pre-audit check-ins. We would actually send out like project management documents. You see that a lot today, giving a heads up, providing the education before the audit, and really just listening first instead of just trying to fit all the squares into round pegs or vice versa. It just is not a one size fit all, and empathy isn't the same either.
Well, so much in what you just said there, and we'll go to you in a quick sec here, Alex, but so much in what you said there, you really stopped and, you said it's important to listen. And listen is not just sitting there with your arms crossed, letting those words bounce off of you. You demonstrated that their voice was heard, and you recognized, obviously, in that process that just like a policy that no one follows is bad news, an audit that people don't participate in and you can't get the feedback from also is bad news, and that is like super ineffective. So I think it's a great example of how collaborating and employing some of that empathy and emotional intelligence got a process that was really going to probably fall flat if you didn't do something really kind of optimized.
Yeah, there was no value at that point, especially with the demoralization. I mean, that's something that I didn't ever want to hear, but it was quite the wake-up call. And it does go back just to think about the way that I tend to approach policy development, and especially being new at an organization. Well, how have you been doing it? What works for you? What is the historical relevance as to why you do it? And just kind of being open to that, because there is a reason. And perhaps it evolves, right? Perhaps audits or policy work or ownership evolves. But I'm always willing to give we can pivot, we can change, we can adapt, we can pilot. We are drivers of, as you say, Nick, the healthcare party bus, beep, beep. So we get to determine where we're going to swerve and where we're going to go over some of those speed bumps.
I love it. Alex, bring us home.
Actually,
bring this party bus home, okay? I hope we all have Ubers, okay? You're not good to drive after this party bus.
Too much fun is happening today. I actually have two examples that kind of tie into each other. And first, kind of piggybacking off what Laura was talking in terms of auditing, our providers, their main focus is seeing their patients and providing the best quality of care that they can. But I think an added level of complexity that our providers within our organization have is that they actually do their own billing as well. So they're selecting the appropriate level, a CPT code and the associated diagnoses and any modifiers and billing that out as well. So understanding that first and foremost, that there's that added level of burden. So not only are they seeing their patients in crammed schedules with every 15-minute time slots, but then they also have to do their documentation and bill for the services as well. And I think we have to also recognize that they're emotionally invested in their work. They want to make sure that they're doing the right thing, but sometimes things slip through the cracks when they're trying to take shortcuts or whatnot in the EMR. But being able to first meet with them and go over the audit, but starting off on the right foot with, tell me a little bit about this particular claim. Tell me about how you went into this. Provide us the feedback. So kind of exploratory and not so much punitive when you meet with them. And I think that'll definitely go a long way. But pausing to acknowledge their feelings along the way. And this has been very helpful because previously we would have not only the provider, but we would perhaps have their administrator or the department chair at the meeting and other individuals where that may be misconstrued for embarrassment or even threatening. But now having those one-on-one meetings to establish that trust with them, you're going to get more information out of them that way. And that way you can help them find the root of the problem to be able to correct it. And one other thing that kind of ties into the auditing, we're an accountable care organization. We have a very big focus on hierarchical condition categories and our risk adjustment factor scores. And even in terms of education and pushing out education regarding the HCCs to our providers and getting the feedback, this is something else you want us to do. Not only are we seeing our patients, we're documenting, we're dropping in the charges, but now you want us to think about these HCCs on the back end. But that really getting that feedback is so valuable because that allows us to take it back and implement any changes. So now our messaging is, you don't need to be concerned. This is just a high level overview for you to be familiar with the terms. Right. What our focus is on is making sure that your documentation is accurate, thorough, you're coding to the highest level of specificity. You don't need to know anything above and beyond what you're already doing. It's just something to be mindful of on the background. So I think to get that feedback and change your messaging definitely is helpful too in building that trust with the providers.
Well, I mean, without it, you're just sort of blindly throwing things over the fence. And back to the point that's been made several times, if people aren't going to actually change their behavior as a result of what you're throwing over the fence, then why even waste your time? So let's get one more emoji explosion for these guys. We're almost at 3,000, smaller group, but mighty, small, mighty group today. No kidding. I hope you all can join us on Thursday. We have Christian Hunt and Bettina Palazzo coming on, and we're going to be talking about compliance failures. It's going to be a really fun session. So encourage you to come Thursday at noon Eastern. And if this is your first time, coming to the Ethics Verse, you absolutely should sign up because why not? It's free. Okay. Love you all. See you on Thursday. And thanks again.
Take care.
3,300 emojis. Boy, we really kind of turned that around there, you guys.